Union Health Minister J.P. Nadda today unveiling the National Health Policy. The policy was in the making, well, not exactly this policy, but we've required a new policy and it's been in the making for 15 years. Finally seeing the light of the day today, positioning it as a patient-centric policy. The Health Minister said that this policy focuses on preventive health care and pushes for more involvement of the government. Let's take a look at the highlights.
The Cabinet has approved the National Health Policy 2017.
The much-awaited health policy was announced, promising affordable healthcare too. The three key objectives of the policy are increased government spending on health, improving the primary healthcare system, and pushing for affordable healthcare. The biggest need was to increase government spending on health because as compared even to Sri Lanka or Nepal that spend more than 2% on health and have a more robust healthcare model, India spends a meager 1.2% of GDP on healthcare. Now, the policy now proposes to push up the spending to 2.5% of GDP by 2025. But the push is to expand primary healthcare and hence more than two-thirds increase in allocation for primary healthcare. The government has also set an ambitious target to build infrastructure so as to provide 2 beds per 1,000 population, a much-needed thrust from the current 0.9 per 1,000 population. A health card for all is also on the anvil. The government aims to provide free medicines, diagnostics, emergency care and healthcare services in all public hospitals. But where it may see headwinds, the government intends to rope in private sector. To bring down out-of-pocket expenditure on advanced treatments, the government is looking at strategic purchases from private sector on secondary and tertiary care. A key move is to regulate healthcare delivery, where the policy proposes to set up a national healthcare standards organization that will set standard guidelines for care and protocols for hospitals. The regulator will also grade both public and private hospitals to help patients make an informed choice. The government says it has set stiff targets for eliminating diseases like Kala Azar, filariasis, leprosy by 2018. That's not all. The policy aims to strengthen healthcare so as to improve on some of its worst performing health indicators, like improving life expectancy to 70 years, reducing total fertility rate to 2.1, reducing under 5 mortality to 23 by 2025, reducing maternal mortality to 100 by 2020, and reducing infant mortality to 28 by 2019. While the government is confident of meeting its stiff targets, how it intends to bridge the gap between the center and state-level health goals remains a big question. This because health is a state subject and wide gaps are visible between states that have implemented good schemes and seen improved outcomes and those that are laggards. In Mumbai, Archana Shukla.
Well, those are just some of the highlights of the National Health Policy, and I discussed the fine print, or at least tried to discuss the fine print with the Health Secretary C.K. Mishra. I started by asking him about how the government plans to meet the issue of raising funds. Remember, the government has decided that over the next few years, by 2025, in a phase, public spending will go up to 2.5% of GDP. Will this only be by way of budgetary support, or are there other avenues that the government is exploring to fund healthcare spending? Take a listen.
When we talk about public funding, we essentially are talking about budgetary support. We are almost looking at doubling what it is by 2025. Right now we are about 1.2% of the GDP. We intend taking it to 2.5% of the GDP. It is essentially budgetary support with some elements of participation from other sectors as support activities to run the programs.
While you've decided to move up to 2.5% of GDP by 2025, and that's a step in the right direction, Mr. Mishra, but the fact of the matter is that this is still significantly lower, not just in comparison to the developed economies, but even emerging comparable economies where the health spend is significantly higher. How did you arrive at this 2.5% number, and is this the best that can be done given India's financial situation?
See, given the resources available and also keep in mind the size of the GDP of India, the resources that would be available are pretty large. We also have to look at the capacity to be able to get value out of what we spend. This is an optimum figure which we think will help us get to the policy parameters that we have set for ourselves. Health spending can never really be enough, but we want to do more and more, and the policy emphasizes that if we are able to do 2.5 by 2025, this will be a significant step in that direction.
Okay, if I could ask you about the alignment between the centre and state, Mr. Mishra, how do you intend to bridge the gap between the goals that the centre has and the goals that the state has? Because at the end of the day, state governments really are in control when it comes to healthcare. We've seen different performance. States like Tamil Nadu and Rajasthan have done a good job as far as the procurement-based model is concerned. Others have lagged behind. So how do you bridge this gap between the centre and states and between what various states are doing?
See, it is a state subject, and the centre's primary job is to handhold and support the states in achieving these targets. As far as the policy is concerned, let me put it up front that each aspect of it has been discussed in detail with the states, and a policy where the state is totally on board and committed to implement this. The second aspect that you mentioned is actually something that is worrisome in the Indian health system. There are huge inequities between the states in terms of performance and also in terms of disease prevalence. There are states which have done much better and which have a capacity to do much better, and there are states which have not so well. The policy aims at supporting, diagnosing the problems with the states which have not done well, focus on those areas, handhold, support those states to move ahead and reach the level which other states have reached.
If I could ask you, sir, in your assessment at this point in time, what are the critical challenges and, the big drawback you see when you're assessing the performance of various state governments, and where is it that you would actually like to handhold to improve the performance?
See, it's about governance, it's about capacity to deliver, it's about focus, and it's about planning. And these are the aspects where we would like to handhold states to take them in the right direction, which is agreed by both sides.
Okay. So you're saying that there is an agreement between the centre and the states, and hopefully as you roll this policy out, you will be able to improve state-wise performance. But, I was listening to the health minister, and he seemed to suggest that there are no dearth of funds for healthcare, but the problem is actually a different one. The problem is spending that money. Where are you seeing, sir?
We've done extremely well over the last couple of years in spending. The states have improved their capacities to spend, and we are doing very well on that. Therefore, it is the appropriate time when we get more resources to the centre as well as the states to step up our health activities, because that capacity to spend is now getting created very fast, and the states which were not doing well have also started the well.
Okay, so you see an improvement there when it comes to spending and improving the healthcare outcomes.
Yeah.
Well, that is the Health Secretary C.K. Mishra there. But what will this mean now as far as private investment is concerned in terms of public-private partnership and healthcare delivery in India? We take that conversation forward with Naresh Trehan of Medanta, Mazumdar-Shaw of Biocon, and healthcare activist Ashok Agarwal, and of course our in-house healthcare expert Archana Shukla will join us. Stay tuned for that CNBC TV 18 exclusive debate. You're watching our special show here as we discuss the fine print of the health policy that's been unveiled by the government. Joining us to discuss that, Naresh Trehan of Medanta, Mazumdar-Shaw, Chairperson Director Biocon, and healthcare activist Ashok Agarwal. Also with us, our resident healthcare expert Archana Shukla. Dr. Trehan, let me come to you now. I mean, this is undoubtedly a step in the right direction. We can argue and quibble about whether healthcare spending to 2.5% over the next 8 years is significant, and is it enough, especially when you compare us to other emerging market economies and forget the developed markets. But what was it that you would like now the government to focus on as it starts to roll out this new healthcare policy?
See, off the bat, it's a very welcome move from the government that at least a comprehensive document has come dealing with several aspects of healthcare of a nation. So on one hand, we want to increase our budget, albeit very slowly. I would be happier if we said that the budget would actually double in the next 3 to 5 years, or maybe 3 years would be the right time. Secondly, it's saying assuring health for all in our country, which is definitely a goal which every citizen would want to see. So I think those twin objectives are very good. Now, how do we go about accomplishing them is to then deal with the situation of, one, how are we going to roll out the insurance policy? Because BPL families need some insurance coverage for sure. It was discussed in the last, in fact presented in the last budget, not this budget, the budget before that, that there will be a 1 lakh coverage for each family per year. We thought was a very good and financially viable move, because even the private sector was prepared to accept that those kind of premiums for the services that they were going to offer, so that even tertiary care would be available to the BPL families, which would be a great move forward. The quantum has not been declared in this policy. The other is when you deal with the fact that we want to decrease the disease burden, which is the fundamental right of every citizen, and also the fundamental of building this block forward. Any amount of budget will not be enough for India unless we decrease our disease burden, and that will only come from our ability to provide those basic hygiene factors, that 5 we talk about all the time, and trying to decrease the chronic diseases that are still pervasive in India, like we said, TB, leprosy, and Kala-Azar. All these things are still there. Now, if we eliminate them, we would be eliminating a lot of demand on our current budget.
Dr. Trehan,
Secondly, what? Yeah.
Dr. Trehan, just the point making about eliminating diseases and the health expenditure, I just wanted to bring in a point and a question that versus the achievable limits that the government has and the targets that they have set for themselves, do you think the budget that they've allocated would still not be enough to achieve the targets? They're talking about eliminating tuberculosis by 2025. Now, that's a huge target if we look at the current healthcare infrastructure in the country and the disease burden.
Archana, it's the basic thing is money is not everything. The way you actually utilize the money, the bang for the bucks that you're going to get, is the key here. Now, one big gap that has stayed is the involvement of all the 3 segments of society that are in the healthcare delivery system: the government, the private sector, and the NGO. We are not aligned with each other. There are thick silos. We are in silos. We don't communicate with each other. We blame each other. This policy should actually promote that eliminating barriers. Let's all 3 of us get together, and in the delivery system today, you can get 50% more health today without spending even a penny if we were aligned. You don't have to. There are areas which are overcrowded. There are areas which have excess capacity. There are areas in the private sector also which can offer. But the basic thing is that we need to actually have them incorporated on a P platform. The other essential is
absolutely
that what the private sector is suffering from is the fact that whenever we offer or we do the services for government schemes, often we are not paid for long periods of time. And some of us can tolerate it, but some of the smaller hospitals are actually being crushed under the burden of the receivables that they're supposed to get from schemes.
Let me just take that forward then.
There are course corrections to be made.
Dr. Trehan.
But overall, let me put it, it is a very welcome move.
Yeah.
Very welcome move, and also the private sector will come on board most definitely as this scheme is rolled out.
Oh, I don't think anyone's disputing that at all. Kiran, Dr. Trehan, they're talking about breaking down these silos with government, the private sector, and the social sector. Every budget we talk about and industry demands, the healthcare industry demands infrastructure status. It hasn't happened so far, but as we look at rolling out this policy and as we look at addressing or course correcting on some of the crucial shortages in the Indian healthcare market, what is it that you would now like to see?
Shireen, to begin with, I think I really welcome this important development to announce such an important national healthcare policy. And I think I completely agree with Naresh when he says that we need to make sure that we are all aligned in optimizing our resources and objectives when it comes to healthcare delivery. Like I just mentioned a little earlier on in discussing with you, we need 2 million beds. That's the hospital beds. That's the shortage that we are addressing today. That has to come from the private sector investing in creating hospitals. Now, unless you give hospitals an infrastructure status, you are not going to, see these investments into hospitals. We know that most hospitals today are financially challenged because you cannot, let hospitals operate on normal sector lending. You have to make sure that you give long-term lending of 15 to 20 years. That's when you get financial stability of hospitals. In terms of job creation, hospitals are huge job creators. The healthcare delivery sector itself, if you just use a thumb rule of 3:1 per hospital bed, addressing a 2 million bed shortage will create 6 million jobs, and so on and so forth. I think you need health assistants like ASHA workers and so on and so forth. So it's a huge job creator. This is an important sector. I think we need a very strong PPP policy. And as I completely agree with Naresh, we cannot afford to work in silos. Secondly, I also want to say that we need to use technology in a big way, because we need to leapfrog in terms of, bridging all our deficiencies.
Michelle,
and getting medical data on a very accessible data platform is extremely important. Getting real-time monitoring of data is extremely important. And there's lots happening. By the way, there's a lot of innovation happening in healthcare. But we need to make sure that the policy addresses this as well.
Michelle, a great point that you've mentioned, and it's good to hear that, a private sector is talking about breaking the silos, of the private sector as well as the health delivery side, because a lot of times we've seen, the private sector and government not being on the same page as far as healthcare is concerned, particularly on the pricing issue. But at this point in time, I would want to bring in Ashok Agarwal, the health activist, to just understand, the government in this policy has also spoken about regulating the hospitals. They've spoken about setting up a standards, healthcare standards organization, which would set guidelines and stuff. From your perspective and assessment of the industry right now, of the healthcare delivery mechanism right now, so do you think this is a step in the right direction? And we have always spoken about center and state discoordination as far as healthcare delivery is concerned, because, you have the Clinical Establishments Act, which the center proposes, only 10 states in India that have, kind of adopted it. So how do you see this mechanism? Do you think it's, a step in the right direction? And what could be the challenges here for the government?
You see, in the present state of affairs, when the Sarkari healthcare system is totally in a bad shape, I think it is a welcome step. But you see, it does not create any accountability. The whole problem is that the healthcare is a public healthcare is a state subject, and in our country there is no state which is having any legislation, because they are just running away from their responsibility of providing healthcare to the people. What is the need of the hour is that the state subject should be brought in a concurrent list. Then it should be made a fundamental right. And then there should be a national law. Why national law is required? Because there is uneven development in the state. You can see Delhi from different parts of the state, UP, Haryana, Rajasthan, Bengal, Jammu. People come to Delhi. Why? Because in those, particularly Bihar, because they don't have a proper adequate medical health care facility in a public system. So they come here. If you have a central law, you can mandate all states that within such and such period, you will create such and such infrastructure, physical infrastructure, faculty, and this, and like right to education, you can do this. In fact, if, there is a chapter in the this policy
document which says that they will do like it is done in the Right to Education Act. But the more you read, then entire spirit of that fundamental right words has been diluted. So what is needed is the law. You can make a state accountable only by law, not otherwise. So what is needed is these things, that it should be brought to the concurrent list, then a fundamental right and a national law. Unless it is done, you see, the common man position is just like a beggar. For if he needs money, he runs to the office of the Prime Minister, runs to the office of the Chief Minister, he runs to the office of the NGOs, and he begs like anything. So unless if you want to ensure dignity of a common man in respect to the healthcare services, I think that it is a need of the hour that the government should make a law in this regard.
A law is what you're asking for. Dr. And I'll give you the final words in 10 seconds. We've seen this policy now being unveiled. What to your mind is the biggest highlight?
So it's just a beginning. For a long time we've been discussing universal access to health for everybody, for the last man standing out there. It is a step that has started the process. I think the two main things, the health card, increasing the budget, albeit I think that they should accelerate the increase in the budget, and also then a very meticulous rollout of this program as fast as possible. We do have the Aadhaar, we do have other entities that we have established. I think with the bank accounts and all that, with Know Your Customer, you can actually roll it out. Now, how it's rolled out, what proportion will the center and state do, and how the payment mechanisms are made, I think will be the key for a wide-based participation. We need the beds, but today, as I said, I will stress again, the infrastructure that's on the ground is actually half utilized. As much as we may talk about some institutions being overrun by patients. And we must look at it. It's Indian asset, whether the government owns it or the private sector owns it or the NGO owns it. It's still Indian asset. And we are Indian asset, must be all integrated together for the benefit of the people. I think that will make the difference.
Absolutely, and we couldn't end on a better note. Dr. and Kiran, Archana, thanks very much for joining us here on the CNBC TV 18 special discussion. We'll be tracking the rollout and the implementation of the National Health Policy, but from all of us here for now,